On February 28th, the United States and Israel launched a military assault on Iran, including airstrikes on the capital, Tehran, and other cities. Iran and Iranian-backed armed groups based in Lebanon have responded with attacks aimed at Israel and Gulf countries, as well as US military and diplomatic targets in the region. The conflict has now spread even wider. On March 2nd, conflict escalated dramatically in Lebanon as intensified Israeli airstrikes caused deaths, injuries, and massive displacement. Luna, you're in Beirut right now responding to those humanitarian needs. What are you seeing as the most urgent needs there right now? What is the team seeing?
Hello, everyone. Thank you for having me. I'm speaking to you, yes, from Lebanon, from Beirut, where over the past 3 weeks we've been seeing a very rapid escalation of the situation. Just to let you know, Lebanon is a country of around 5 to 6 million people that is hosting not only Lebanese, but Syrian refugees, Palestinians, and migrants from a lot of different countries. And today we are looking at more than 1 million people displaced. So this is not a localized crisis. It's affecting the entire country at a very large scale. It is important to understand that this is happening in a context that was already fragile from the previous war that did not stop. People did not recover, and the system did not recover. The health system was already under pressure, and many families were already struggling before this second escalation, and did not get any recover chance. If we could look at the map, I can really show how the crisis is moving across the country. These red areas are the areas that received a blanket evacuation order. The most affected areas are in the south and Nabatieh Governorate, and there is another one in southern Beirut, and a third one in north Bekaa Valley. From here, we are seeing people moving from the south. We are seeing people moving from northwards toward Beirut, Mount Lebanon, and west and south Bekaa, where they relatively would feel safer. So the crisis is not only where the strikes are happening, it's also where people are arriving and where the pressure is now building. Today, we are looking at over 1 million people displaced across Lebanon. Around out of these, 150,000 people are in official open shelters, but a majority are not in the shelters. They are staying with relatives in overcrowded homes or in informal conditions. And we're seeing an extreme overcrowding. Sometimes people stating that 50, 60 people are staying in one single apartment, and many others are completely outside the system, staying in unfinished buildings and buildings under constructions, parks, open spaces, streets, even sleeping in their cars. And it's important to say that it's still even very cold in Lebanon. So at night, temperature drop. A couple of days ago, there was a thunderstorm, and families without proper shelter and heating, blankets become really a direct health risk. Regarding the shelters, even the conditions, the official shelters, there are schools and halls, and the conditions are extremely difficult as well. People are staying in shelters that are not ready for living. They're overcrowded, lacking privacy, without adequate water, toilets, showers, sanitation, or heating system. In many cases, conditions are not suitable for people to live with dignity or safety. After 3 weeks, the situation is not improving and it's accumulating. So what we are seeing now today is really a combination of acute and chronic medical needs at the same time. The acute side of it is the injuries and the trauma cases. We have over an accumulation of 4,000 casualties, out of which around more than 1,000 deaths, including women, children, elders, patients arriving late, sometimes already either dead to the hospitals or in a critical condition. Hospitals are under pressure to absorb these cases. And beyond trauma, the acute needs are also include respiratory infections due to the cold and the skin diseases, dehydration, stress-related symptoms, and all of these are linked to the conditions that people are and living in overcrowded and poor or cold sanitations. People that fled without their medication, without follow-ups, without proper access to care. So we're as well seeing patients with diabetes, insulin dependent, with hypertension, epilepsies, asthma, mental health conditions arriving after days or weeks, even now, without their medication yet or treatment. And their conditions are already deteriorating. A very specific group that I would like to highlight is particularly the children. We're seeing children with respiratory infection linked to the cold and overcrowding, interrupted vaccination, lack of pediatric follow-ups, and increasing psychological distress. So for children specifically, they are very quickly affected by these conditions. I do want to highlight as well the strong and growing mental health burden. So people who are distressed, exhausted, with living in uncertainty and affecting both children and adults.
Thank you, Luna. And I'm glad that you brought up those issues of chronic illness, of things like vaccinations. We often in conflict settings like this consider war wounds, right? But it's worth reminding, I think, our viewers that we're talking about displacement of 1 million people in a matter of weeks. And when you're forced to drop everything and flee your home, often treatment for chronic conditions is interrupted. As you mentioned, children are not able to get routine vaccinations. So we're not just talking about the direct effects of conflict, right? We're also talking about all of these all these health issues that come along with sudden and massive displacement. I have a couple of questions for you, Luna, about MSF teams, actually. I think it's important to note that as in all MSF projects, most of our aid workers are from the community that they're now serving, right? They are Lebanese, often working in the places where they are from. And many of our team members are experiencing the same realities on the ground as our patients are. Could you help us understand what this means for them, and also how these ties to the community inform our work in Lebanon?
So before the war, we had our regular activities as well, and it was in north of Becca or in the south. So currently, most of our staff are from the community that we're serving as well. They could be from the displaced communities. So they're not only responding, they are also living this crisis. Some are displaced themselves, some have families in affected areas still away from them. And what it brings is very strong understanding of the context. They know where people are, they know how they move and what they need. But it also means they are under emotional and personal pressure. So part of our responsibility is also to support our teams so they can continue supporting others.
Thanks, Luna. And I think that's a really crucial point to reinforce here, that this is difficult work, and trauma is often part of the work. And it's a part of all MSF projects to provide psychosocial support to patients, but also to staff, right? To make sure that they have the resources they need to provide care. And related to this, I actually have a question submitted from a viewer. This is a question from Philippe. Given the intensity and unpredictability of the current conflict in Lebanon, how does MSF ensure the protection of staff and patients there?
It is indeed a more like an aggressive escalation this time compared to the previous one. Staff safety is always a priority. We have a continuous access risk and adapt our movements, and we follow strict protocols in that regards. It's always a balance between maintaining access to care and managing the risks.
I'd like to follow up on something you just said about the ferocity of these recent attacks. This is not the first time that you've responded to an escalation in conflict as an MSF staff member. 2 years ago, MSF teams expanded activities following intensified Israeli bombardments and ground incursions in Lebanon. In addition to the intensity of the attacks, what has made this different? What makes this situation more urgent than the one that you and your team responded to 2 years ago?
It's really rapid. The escalation is very rapid, and the changes are very rapid as well. And we have to manage and adapt to the needs. The difference is that there are still in those evacuation the areas that received an evacuation order, there are still families staying and stuck over there, not because they want to stay there, but they don't have a choice. So elders, families that have elders or people with disabilities that don't want to leave their homes or rather stay home, cannot live in shelters, do not have the possibility financial to rent a home, or we are even seeing more civilian casualties. Due to this, we're seeing more civilian casualties in the hospitals. We cannot predict where the airstrikes or the attacks would be anywhere. It could be anywhere in Lebanon at any time.
Yeah, and in addition to the security concerns, we're contending with a lot of other issues, as Tarana alluded to earlier in the briefing about supply issues, staffing issues. Aside from the insecurity, what are the current biggest challenges MSF teams are facing when trying to provide care right now? Is it about staffing, supplies? We know that infrastructure has been targeted. What are the biggest challenges you're facing?
So there are several key challenges. First, it's the access. So especially reaching people outside of the formal shelters, access to reaching people who are in the areas that receive the blanket evacuation orders. There is the second, that is the situation evolving very quickly. So we need to adapt very fast. There is the hospital managing the trauma at a large scale that is increasing in basic health care needs as well. For the other services, the medical services, the logistical and supplies, it's ensuring medication and equipment to reach multiple locations where we are having our activities in the south, in Bekaa Valley, or in Beirut. And finally, of course, it's the staff capacity and well-being. So the teams are working around the clock under pressure while being affected themselves.
Thanks, Luna. You touched on this a little bit, Luna, but I would like both of you to consider this question. I think I'll ask Luna first. What would you like people who are watching this, who are reading about this emergency, who are following MSF's work, what do you want them to understand most about the patients and communities that are affected by the conflict in the region right now?
So if there is one thing I would want people to understand, it's that beyond the numbers, people are trying to live in conditions that are simply not sustainable. Families in the shelters not fitting for living, people sleeping in the cars in the cold, patients without treatment. And after 3 weeks, people are no longer coping. They are running out of options because every contribution allows us to reach more people, maintain essential care, and prevent further deterioration. this is not only a crisis of conflict, it's a crisis on how people are forced to live. And that is where the health impact becomes more visible and where support makes the biggest difference.